Lalabalavu.
Thank you, Mr. Speaker, sir, and I thank the Honourable Member for his question. The national policy on healthy catering and sale of food and beverages at all government ministries and institutions and its SOPs and guidelines were launched on Wednesday, 14th of February 2024 by the Honourable Prime Minister, and Cabinet has also endorsed the adoption and the implementation of this national policy at all government ministries and institutions. And the new policy supersedes its predecessor, the Healthy Catering Guideline, which was endorsed in Cabinet of 2017. So this is a bold step in tackling NCDs in Fiji. And mainly the ultimate goal of the policy is to reduce the number of people in Fiji developing NCDs and succumbing to the complications of diabetes, heart disease, which are the most common causes of sickness and death in Fiji. So for some clarity, the last 12 months, the Ministry of Health and Medical Services, together with our JICA partners, conducted screening activities at 107 workplaces with 3,456 participants was assessed. The results showed that 50% of participating workers were obese, 32% have high blood pressure, with 5% had severe hypertension category. In addition, 60% of workers in the age group 20 to 25 years were at high risk of developing an NCD, while 41% had a high risk of suffering from heart disease in the future. So these findings are consistent with our national disease burden, with heart attack as our #1 killer, coupled with the risk of obesity and high blood pressure, as well as the reports from the 2021 Food System and Nutrition Survey and the Multi-Indicator Cluster Survey of 2021. So therefore, in summary, Mr. Speaker, sir, the policy has been adopted, and it's mainly to try and reduce the effects of NCD in the workplace now.
Thank you.